All right, welcome back. This is Dr. Jin Sung. Today is Tuesday, 12:30, and today we're going to talk about brain and the evils of gluten and dairy. Now, the staple food here in the United States tends to be bread products, pastas, and dairy. And I'm telling you right now that this may be detrimental to your brain function. Okay? So when we look at the brain, it's very sensitive to toxins. It's very sensitive to stress and inflammation. And what gluten and dairy can do is cause almost silent or low-grade inflammation that can affect the brain over a long term. So let's kind of talk about gluten and dairy kind of together. Essentially what happens is when we look at gluten, people always talk about celiac disease, which is an autoimmune disease caused by gluten. So when you ingest gluten, your breads, your pastas, your cookies, and flour products, etc., it creates microvilli damage in your small intestine, and it gets to a certain point, and you finally get diagnosed, and you have celiac disease, which is an autoimmune disease. So your body's immune system looks at gluten and goes, I don't like that, and I don't like the small intestine portion where it's trying to absorb it. So it creates blunting of the microvilli, and when they finally do diagnose you, it's almost too late, right? Because there's a lot of damage. And then you have to take years to recover from it fully. So when we look at gluten in the traditional testing, the gold standard is an intestinal biopsy. So when they go in through the mouth and they'll take a sample of the small intestine and we'll determine if you have celiac disease or damage from the celiac disease. Another way they'll do it is on blood tests. They'll look for maybe a couple of different markers for gliadin, which is a protein of gluten or basically wheat products. And if you're positive, they may suspect that you may have some underlying gluten sensitivity or celiac disease, and they might send you out for additional testing. What I'm going to tell you is that the testing through the blood work is very limited. It doesn't pick up on a lot of different other proteins that are in gluten, and it will be missed, especially when you have a lot of symptoms and then they do the blood test and they go, hey, you're perfectly fine. Yet they missed a huge component of the gluten protein. Like, let me give you an example. There's a lab called Cyrex Labs. It's a lab developed by Dr. Vajdani, who's a leading immunologist in the world. And what they do is they look at different markers. And his markers for gluten sensitivity there's like 24 of them. So he checks for IgG and IgA, and there's 24 different markers that he looks at and says, does this person have an issue with gluten, right? And the traditional testing is just like 1 or 2, right? So if you do 1 or 2 and you're negative, what about the other 22 different markers that might indicate that you have a problem with gluten? Okay? Within those 24 markers, there are certain markers that affect brain, right? There's something called transglutaminase, and then there's something called gluteomorphins, right? Gluteomorphin means that gluteal protein or marker can affect the morphine centers of your brain, right? Think about it. People are addicted to foods, right? They crave foods, they want foods. People actually have withdrawal symptoms from certain foods. It's because these foods, like gluteomorphins, in dairy there's something called caseomorphins. They affect the brain, opiate centers. Of course, if you stop taking them, you're not going to feel as well. You feel like you're going some withdrawals, right? You don't feel good. So what do we need to do? We need to be able to test properly for the gluten protein and all its components, and the proteins for dairy, right? It's just not the caseomorphins, right? Most people think of lactose intolerance. You know, I have lactose intolerance, therefore it's creating problems, right? It's more than that. It's not just the lactose. It's the caseomorphins, the whey protein, right? The other components that we have to talk about is the way things are processed. It's no longer just a clean product, right? When you look at gluten and the way it's processed, there's this whole process of deamination, right? They take the protein, gluten, they have to deaminate it. And it's a chemical process which makes the gluten worse. And also the gluten or the wheat proteins are produced by using hybridization. So they take certain seeds and they hybridize it. So it's no longer the wheat that we used to have a long time ago. It's very different. So it creates an issue in terms of how the body recognizes it. Right? The other problem with gluten and these products, or even dairy, is all the use of hormones and antibiotics in the cows, but also the herbicides and pesticides and the glycophosphates that are used in order to produce the wheat products. And it creates a big problem for the individual because these glycophosphates will bind to the protein and it actually changes the molecular structure of the gluten protein. Therefore, your body looks at it, or your immune system looks at it and goes, huh, what is this thing? It's creating a problem. I don't understand what this is, right? So the immune system overreacts, causes inflammation, and the inflammation will lead to neurodegeneration, or degeneration of the brain. It creates problems in the brain. Anything that inflames your GI tract will inflame the brain. In the medical literature, it's actually stated that your gut is your second brain because it has so many different nerve endings in there that it's almost considered a second brain, right? The other problems with it is exposure to mycotoxins, right? When they store the grains in these huge silos, it has issues in terms of mold, fungal, and enterotoxins that build up in the wheat product itself. So there's a lot of problems in terms of the way it's produced, the hybridization, the way it's stored. It has a lot of different issues, right? And then your body takes it in and it goes, hey, I don't know what this is. And it's causing some problems for me, and the immune system overreacts and it attacks it. Attacking it will increase cytokines. It'll skew your Th1 and Th2 systems in terms of your immune balance, and it will create havoc in your GI tract, leading to inflammation. That inflammation will become systemic. It'll go everywhere, and then you'll start to develop brain fog and issues in terms of short-term memory, fatigue, depression. Right? No one correlates food with depression and anxiety, brain fog. But it's a real connection, and people need to handle these things ahead of time. You can't just wait to the point where it's so bad that it finally shows up on a blood test or a intestinal biopsy. As a matter of fact, a lot of the people who are diagnosed with celiac disease, it takes them years to be diagnosed properly. Because when they do test initially, they go, hey, you're fine. I don't feel good though, doc. Why am I feeling so bad? I don't know, but everything else looks great. So don't worry about it. Just go about your way. And then a year or 2 years or 3 years down the road, they finally get diagnosed. Oh, well, you have gluten sensitivity, or you have celiac disease. Now you have to stop eating gluten, right? And for some people, that will be enough to start the healing process. They start to feel better and so forth. But then there are people who do not feel better on a gluten-free diet. They still have issues with brain fog, degeneration, GI symptoms, and a lot of different symptoms like joint pain, swelling, etc. And those are the people who are reacting to the alternative gluten-free products, alternative gluten-free grains, things like rice, things like millet, quinoa, right? Amaranth. So there are other wheat products or wheat substitutes, let's say, other grains that substitute gluten-containing wheat products that might be cross-reacting, meaning the alternative grains look like the gluten grain, right? So the rice or the millet or the quinoa, certain components of it, right? Certain amino acid sequences look identical to the gluten protein. Therefore, your body's immune overreaction will start attacking the other products, right? And then that all leads to things like leaky gut and so forth. It damages your gut lining. Proteins that should not cross into the GI tract will start to cross, and then it creates more inflammation. So it's a perpetual thing, right? You have to be able to accurately diagnose the problem, whether it's a gluten problem or an alternative grain problem, or is it a dairy problem, right? Because you have to be able to eliminate it completely, right? So I have some people who come in and go, I'm on a gluten-free diet. I only eat gluten maybe once a week. But I don't feel good though. I'm pretty much gluten-free. What that tells me is that that patient is exposing themselves to gluten once a week, right? If you look at the immune response to certain foods like that, is you have a spike in your immune system after exposure that can last up to 2 to 3 months, and then it'll start going down. So if a patient goes, I'm gluten-free, but they're eating gluten even once a month, what happens is you get this exposure, and you get this spiking of your immune system, right? And then as it starts to calm down, you have another spike 1 month later, right? And then another one another month later. And the immune system never calms down. It's always, always activated. And it creates autoimmune processes. Things like Hashimoto's thyroiditis, right? If you have Hashimoto's thyroiditis, guess what? Every cell in your body is going to be affected. Brain function to weight gain to hair loss to skin issues and all the other things. Okay? The certain sequences of the gluten protein also looks like the cerebellum and the thyroid. So you have gluten exposure, I have gluten sensitivity, I don't do well on gluten, and then when you eat it, it can actually affect thyroid because certain sequences in the gluten look like thyroid, and then certain sequences that look like thyroid also looks like the cerebellum, or the balance center of your brain. So it's this cascade. It starts to affect the GI, the neurological tissues, then affects thyroid, then affects cerebellum. Cerebellum will start to affect the frontal lobe, so your decision making, right, will be off. Your executive functions will be off. Or you can have global inflammation in the brain, and it can create problems. They can do antibody testing for this, where you can look at basic myeloprotein to see if it's affecting nervous tissue, or anti-cerebellum markers. So you can actually check for these things. So when we look at just foods like gluten and dairy, we have to understand that it affects not only our stomach, it affects neurological tissue, it creates inflammation, inflammation goes to the brain, breaks down the blood-brain barrier, and things that shouldn't get into the brain will get there, and then you have activation of what we call microglial cells, or the immune cells of the brain. And then when they get activated, they become very angry, right? They start to destroy neighbors, where you don't want that to happen. So you have this cascade of things, right? You're taking in foods that are hybridized, herbicides, pesticides, hormones, all these things, causes inflammation, gets into your body, affects the cerebellum, affects the thyroid, right? Affects the GI tract. Actually, gluten is also associated with peripheral neuropathy, numbness, tingling, or abnormal sensation in the feet, or in the hands, or in the face, right? It affects all nervous tissue. As a matter of fact, one of the main signs for gluten sensitivity or celiac disease is not stomach issues or stomach pain. It's neurological issues. The anxiety, depression, and fatigue are the first things that really show up for a lot of patients. So you have to remember the evils of gluten and dairy, right, will impact brain function. If you don't handle that, you will never get better. So I'm at a point where in my office, a patient walks in and they've been to 5 or 6 or 7, 10 doctors, and they come in and still have a lot of these chronic complaints. It's almost mandatory that they're going to be on a gluten-free and a dairy-free diet, right? Because we have to calm down the inflammation. Okay. Now, what do we do when we are a gluten-free person who's trying to eat clean and we're afraid to eat out because of the accidental exposures to gluten, right? If we have accidental exposures while we're eating out, you can get inflamed. So there is a product that can help with that for accidental exposures. It's not meant so you can have a big bowl of pasta and pizza and then go, okay, I'm going to take this vitamin to help me minimize the impact of the gluten. It's more for accidental exposure, or what we call cross-contamination in the kitchen, where they're making your food that's supposed to be gluten-free, but it's on the same plate or same counter as the bread that was cut or the fried calamari that was there, and you're getting exposure of gluten accidentally. So this is the product. There's a lot of different companies that produce this type of product now, but again, I like Apex. It's called gluten flam, right? Gluten flam. The main enzyme in here is called DPP4 peptidase. DPP4 peptidase. And what that does is it has the ability to break down the gluten protein rapidly before it hits the small intestine and causes a lot of inflammation, right? So it's a prophylactic, but it's not meant to use it where you just go, I'm going to just have that and eat whatever I want. That's not the idea. So if you have any questions, please write down below the video, and I try to get to that on a daily basis. And I thank everyone who's been watching. I thank all the people who have been sharing. It's been a fantastic few weeks doing these videos and getting the word out. So please share, okay? And we'll see you next Tuesday at 12:30. Have a great day.